Hello, everybody. Good afternoon. We are so happy to be back together again to talk about how we support our children, our families, our children with special needs during COVID, in times before or after COVID. Just how do we support our babies and our families? My name is Zach Wright. I'm here with Chioma and Joy Alam. We're going to be talking today, building upon our last episode. Our first episode was kind of talking about what all of these words mean. IEP, 504, LRE, IDEA, right? That was our first episode. Today, we're going to be talking about how do we begin to advocate for our children? How do we begin this process? So the way we're going to kind of roll this out is I'm going to start by talking about really my experiences of just that emotional roller coaster of how to navigate the world once you've learned that the baby you love has a diagnosis. Then talking about getting motivated, finding your crew, finding your squad, and then we're going to move on to Joy, who's going to be talking about organizational strategies, and then Chioma about how to prepare for certain scenarios. How do we prepare for our first IEP meetings? How do we prepare for our school transitions? And at the end, we're going to leave some space for questions because we know that last time there were a lot of questions that we didn't get to. So that's what we're going to be doing. So we want to start off today by kind of just talking about that moment when you realize that something is up, that something is up with a baby that you love, and it might be outside your area of expertise, but you know something is up. So I'm going to speak from the I here. As I mentioned in the first episode, moms know. Moms know when something's up. And my wife knew that something was up with our boy Leo, and so we got the appointment with our developmental ped, and we had our meeting, and at that meeting, we were actually discussing this morning, my wife and I. I remember I asked her specifically. I said, so you've told me what autism is now, and you've told me that there needs to be social rigidity and repetitive behavior for the diagnosis to be there. So now I'm asking you directly, does Leo have autism? I remember I had to ask that question. And she said, yes, he does. And Laura and I talked how we went home. Laura remembers how being in bed in a dark room after we heard. And I remember asking, and she said, what does it mean? What does it mean? And I said to her, it means that our boy has autism. That's what it means. And the first thing I think families need to do when they get the diagnosis, or at least what worked for us, was to face it, to face that truth and face it and say, this is now our new reality, because reality will never be the same. And lean into it, lean into that new reality. Emotions are going to be there, and they are wild. And for us, it was a mourning period of mourning all the things that now we thought maybe were gone. Like maybe normal childhood is gone. Maybe normal a normal preschool is gone. Maybe a normal elementary school is gone. None of those things ended up being true, but that was where we thought. Of course, we go crazy. Maybe like, will they ever get married? Will they ever fall in love? Like all these things, right? You project forward. But then we needed to transition from emotions to advocacy, which is the tagline of a group called Wright's Law. Wright's Law it was a book that someone gave to me, and I'm going to actually pop it in the chat so the people who are running this thing can maybe make it visible. It was a way to kind of get some control over the world when the world was completely out of control. We went from a space of being overwhelmed emotionally to saying, well, what can we do? And the first thing there are two things that I'm going to talk about before I pass it off to Joy. One was we had to get organized. We needed to get all of our papers in a row. We needed to get all of our things organized in one place in a binder. We need to have his diagnosis. We need to have his insurance. We need to have the social security. Like we needed to have all those documents in one place and have it updated. And that became my job because that was the way I could have control over a world that I had just realized I have zero control over. The second thing that we had to do, was find our crew, find our squad, find our tribe, find our family, whatever it is. Because what we learned is our friends and our family will love us and will want to help us. But if you are not a part of the special education world, you cannot understand. You just can't. You just can't. My mother loves my grandchildren as any grandmother, as any particularly Jewish grandmother does, right? Like over the moon, right? I remember we had to make her say the words that Leo had autism. Because to her, he's perfect, right? He's perfect. But we had to make her say it. And we realized, Laura and I, that we needed to get a crew outside of our family and friends, a crew that understood. And that's what we did. We found our autism support groups. We connected with other moms, other dads of autism, other play groups, people who understood the terminology, and frankly, people who could guide us and let us know what we needed to do and know the questions to ask. Because our first meeting with the state, they told us Leo had anxiety and that he would have a push in person once every 2 months or so. And we were like, okay, sounds good, thank you, because we didn't know anything. And when we brought that back to our group that we had found, they said, absolutely not. Here's what you need to do, X, Y, and Z. So that's what we did. We went from emotions to advocacy and found our crew. So, Joy, we're going to pass it off to you. So, what are some of those organizational strategies that families can utilize to kind of begin their advocacy?
Hey, thank you for asking. So me being from San Francisco Bay Area, I'm here in Oakland. Fortunately, my experience, because I was already working with an inclusion group through my job, working as a special ed instructional assistant, as well as with an inclusion after school summer program. So I was aware of some resources that were already available for parents and families to take advantage of where they could get services. For me, like Jack said, my daughter too. I thought she had autism because it took her a while to communicate. She had a hard time communicating. And fortunately, because of my job, I knew of an organization called Regional Center of the East Bay. And it's out here, they do assessments for free as long as the child is younger than 3 years old. And so, um, because I was already equipped with that knowledge, I was ready to go if I knew she had autism because I worked with students with autism. So I wasn't afraid, and I felt more so empowered. And when they did the assessment, Regional Center of the East Bay, they said that my daughter didn't have autism, and what she had was auditory processing disorder. So that's why it was hard for her to communicate. So thanks to her having that support, me that as well, they were able to provide one-on-one support until she became 3, because I caught it right before she turned 3. And so then from there, they were able to recommend transitional kindergarten program in Oakland for her to keep working with her speech and to get services. So from that's one organization. Out here in the Bay Area, there are other organizations to help families with of a variety of disabilities. And so, like for me, I wear hearing aids, so I'm aware of organizations to help people with hearing disabilities. And so, again, when it comes to advocating, like I said, I knew something was wrong, but I knew how to just address it. And, thanks to me advocating, like I know something's not right. People kept telling me, oh, she'll talk when she's ready. No, I said, no, no, no. She seems to have a hard time communicating. So thanks to me knowing my child, and now I knew how to advocate for her when she left her transitional kindergarten program to go to a regular school. Um, and she went to a charter school. And again, I had to again advocate for her when a school psychiatrist um, decided to diagnose my daughter with autism when I had her assessed for autism at 3 years old. And I said, no, she doesn't. The regional center of each of these states says she doesn't. How does your opinion overrule theirs? And they don't. But I had a hard time challenging her decision. And so instead, I was like, well, whatever you think of my child, it doesn't bother me because I know what she has. And just recently, she graduated from fifth grade from that school. She went to a new school. I had to tell them she has an IEP. She was, I think, mislabeled with autism. And they said, well, good thing is it's time for her triennial, which is every 3 years, an IEP, individualized education plan, where it's the teachers, parents, um, other specialists like the psychiatrist. It's a team. Speech therapist. It's a team, and it's every 3 years they do this big assessment. And please don't feel overwhelmed. It becomes like second nature to you once you get into this. But um, that team said she's in sixth grade at that time. They said your daughter is doing well in her classes. She doesn't need special ed, I don't think. And when they did the triennial, um, they found that she was misdiagnosed with autism. And then they even said, we don't see that she needs speech therapy and the other services she used to have. She obviously has improved. And so they closed her IEP case out because they said she seems to be doing well. But that's a very rare case. But again, everybody's different. But because I advocated for my child and I spoke up for her, um, look at the results of what happens when parents and the school team or community work together to help that child.
So let's think about that. And Chioma, I want you to come in here for us. Let's say that a family suspects something, that a family suspects that a child is in need of some kind of services, that something's up. Um, what do they do? Like what's the like if we start at the beginning, what is the first step?
Oh man, the first thing would be first checking with your doctor, pediatrician. But sometimes they don't always know. It's a lot of information. Well, I would put it like this: it's hard to navigate all of these information and find these groups or to properly address what you're looking for. But you can start with a pediatrician. Depending on your area, some pediatricians know and can refer you to other services where they think will really do a thorough assessment. But again, sometimes parents, we don't know what's available until we maybe talk to other parents and families and see about getting help. It's okay to say, I think something is wrong with my child. I don't know, but I could use some assistance in looking for resources. Sometimes, they don't have to have someone, they may know someone who may be able to help you. It's okay. We got to come out of this fear of, I don't want people to know that something may be wrong with my kid. It's okay to ask for help and just to tap into that community. But that was the first thing for me was I kept challenging the pediatrician and then I just did it on my own.
Yeah, I'll add in to that. Like, I think it's really important for me, and just kind of thinking and hearing you all and reflecting on my own experiences. I don't know if there's a universal first step. I do think that a lot of it is culturally impacted. Like, culture has a lot to do with how you come to terms with disability, even though like ableism is something that cuts across, many ethnicities and racial backgrounds, and even, countries. Like, most people struggle with, ableism, as in the concept of like how you think about people with disabilities, how you treat people with disabilities, how you perceive their strengths and weaknesses. And as parents, when we're just coming to that emotional place of understanding, of course it can be at first like possibly traumatizing. And for me, like, the trauma really comes from navigating the systems. Like, I mean, I was an advocate activist long before I had kids. And so, once I first kind of got whim, and I wasn't the first person to observe, actually it was my grandmother, my non-English speaking grandmother, who was a school teacher in Nigeria. And so, here she was with my under 2-year-old son, and, her just recognizing that he wasn't doing certain things that she thought he should be doing by 18 months, by the time we started trying to investigate. And then he would do peculiar things like line up cans. He was fasted walking. He walked at 9 months, and he started drawing and writing like at 18 months. So there's certain skills that he was doing very quickly. And then he had these peculiar things. And then he wasn't speaking at all, right? He didn't even have his first two, you get your twos and your fours, your teeth. He was completely gummed till he was 2 years and 3 months. So that was, there were some interesting delays that made it interesting for us to identify. I would say their father, my family's immigrant Nigerian. Their dad's family is African American, traditional descendants of enslaved Africans here. So our approaches to, what was going on with our son was slightly different. But we both my mother and his mother came to similar conclusions out of fear of not wanting him to be labeled, not wanting him to be exposed in a certain way that was out of our control. But, and I think a lot of families kind of start there, like trying to contain the situation medically. And if you're lucky, your pediatrician is a good ally, but that's not always the case. I was also fortunate to be in an African-centered child development center. We were at Roots Public Charter School. It's also a child development center for birth onwards. And so, in that space, I was able to get support to be able, to understand some of my opportunities. Like I learned to find out that there was Strong Start, which is our Part C program here in DC. So every state has a Part C. So we talk about the IEPs, and I think I mentioned this the last time, but not every family kind of knows early intervention services that are available. My oldest was able to get an evaluation through Strong Start, and that was his very first diagnosis. But then transition to Part B was traumatizing because we then had to increase healthcare access to supplement what we weren't able to get once he transitioned out of Part C. And I don't want to, again, get overwhelming or technical, But I think the start of the story really comes, like I think as you, Zach, said, with coming to terms, like facing it head on. I've also had the pleasure of supporting other families. So I've worked for many years as an advocate, even part of my company, She Born Free, we're able to take on individual coaching. I'm a trained early interventionist, as in I'm certified to support families through the Georgetown University Center for Child and Human Development, to support families, particularly in the early childhood, on how to, identify issues and to do things that are routines based and that support you with or without a diagnosis. I think that I've also had the opportunity to see families at different points. Sure, a pediatrician may be your natural first point if you're dealing with a small child under the age of 5, but I know families who have not gotten diagnoses till high school. And I mean, it's just a different reality if you catch on later, depending on what's happening. So there are different areas, and hopefully throughout the conversation, we can delve in at different points.
Yeah, this is so. It's funny. These conversations, they make you relive stuff, right? They make you like relive what we went through. So our pediatrician is a lovely woman. Missed it. She missed it all. She just missed it. She kept telling us he's just intense. He's fine. Like, and the thing is about this, as you say, like, you need to get this as early as you can. So like so when the pediatrician is telling us that, like, we are missing months of services that we could have accessed. So when we finally did get the diagnosis, and one of the things I want to talk about is what to kind of like expect and do through the diagnosis process. One thing I just want to add before we kind of get to that is one of the things that there are two things that our developmental Pete told me that I think about all the time. One, she told me about my son Leo, who at the time was having this very intense emotional, just overwhelmedness. She said to me, if he could stop it, he would. And I remember that floored me at the moment, because I was a dad raised in the 80s. I got angry. That was how I was taught to be a parent, right? You get angry. And that really made me, one, weep, but two, like really pause, like, that's right. Like if he could change, he would, but he can't. The second thing she told me was, you're going to get a lot of extra love from your family. Use it. Take it. Like, take that extra love. You are allowed it. And we've called upon that, where if things a family gathering, if things are hard, or if we need a little extra help, blah, 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 like, we are going to cash in. We are going to cash in on this extra love, because Lord knows we have other things to handle that the rest of our family does not, right? So we're going to cash in on that love. So let's talk a little bit about, let's say parents, families, caregivers are getting ready to go into this diagnosis process. What are some things that they should either expect or prepare for, either mentally or just practically? And Chioma, Joy, either.
Yeah, I mean, I just want to kick off and saying, again, it depends on the stage in life, right? Like, I think the best case scenario is that your child is very young, hopefully under the age of 3, because we know that you really have, our science shows us that the brain is most mutable and amenable and is processing information at the fastest rates before the age of 3 years old. So early intervention can happen at any stage of anyone's life, prevention and early intervention. But in terms of a disability, early childhood intervention really suggests the need to really address like the issue as early in life as possible. And that can even be in utero. We know that Down syndrome's families have an opportunity to know of a diagnosis in utero. Like you can test for Down syndrome when you're pregnant, and a good pediatrician or good OBGYN rather would be able to help you in that process. And you should be able to get counseling and parent training even before the baby is born. For the diagnostic process, for those of us living in the autism reality. We know that it's different for children that are hard of hearing or deaf. We know it's different for blind kids. We know it's different. We know that a kid will not likely receive a dyslexia diagnosis till at least after the age of 7 or 8 years old. We also know that a kid with bipolar, it's more than likely, I've seen some early childhood bipolar diagnosis, but we know that a bipolar kid is most likely going to get diagnosed in high school or even in college or beyond, right? In their young transition to adulthood. We know that different schizophrenia can show up at different stages, but most acutely in adulthood. So there are different times throughout the lifespan that we're going to be faced with different kinds of diagnostic processes. I think the most common, the most prevalent, we know that 1 out of 5 kids has an autism or has autism, is autistic. And and so that I'm just going to speak to that, because screening for autism is also being aware totally of all the developmental domains for your child. Like any good pediatrician, any good early childhood provider should be empowering the parent with the domains of development and the stages in life you're supposed to reach your milestones, so you can participate in the observation that can help you identify when things may not be atypical. So I don't like to use the word normal, because what is that? None of us really are normal. We are either typical or atypical, right? We're either atypical or non-typical developing. So, to that, it's good to know, like, the Center for Disease Control has Act Early, Learn the Signs. You can get that information for free. Most states, some states, because of funding, have an Act Early ambassador. That person should be, active in communicating to pediatric facilities and offices, as well as with early childhood centers to disseminate information. I'll just say this and then pass this on to you guys, that the diagnostic process is unfortunately, culturally biased. And I think that may explain some of the issues that you face, Joy. We know that that a lot of the diagnostic tools, I think some of the most common one are for autism, grade A, best way that you can diagnose an autism, to get the best autism diagnosis is called the ADOS. But we also can use for screening, you can use the GAUS, and don't ask me what these are acronyms for things. You can also have the Ages and Stages questionnaire, which can be a universal screening tool to help decide when a child is experiencing, atypical behaviors or non-typical behaviors, right? So we know that universal screening is really important in early childhood. Head Start model, if you go to a school with Head Start, they should be able to do screening. And so there's a difference between screening and going through a full total diagnostic. A screening should be able to help you get at the best information to know if you need to further diagnose through more expensive means, like a neuropsychological evaluation or a neurodevelopmental assessment. The cultural bias, I think, falls in that these are evidence-based processes, but most of them are tested out on middle-class white families. So we have not till date, even when we have great tools like ASQ, Ages and Stages, or MCHAT, or ADOS, or different even genetic testing that happens. A lot of it is being done, the evidence that they're using to support these tools are being done on rich white families. So they are not necessarily developing tools that can speak to cultural issues that may come up around the diagnosis process. Some kids may be able to be may have the ability, may show up like they have like autism or something, but they're really just not responsive to English. So a lot of kids who are dual language in the early stages get missed. We know that literacy is also a challenge in which one has to be very careful how you diagnose that, especially if you're using tools for dysgraphia and other things to help you understand dyslexia or other associated disorders. So, I mean, we have to be vigilant as families. It's really hard to decide because it's such a diverse field and we're all coming at it from different places. But I think maybe the best thing is what Zach, you said, trust your gut. Trust your gut and don't stop till you get the answers that you need to support your child. You are their first teacher.
Joy, when we think about families with, in particular, hearing issues, what do these families need to know?
So I want to add that I was born with a hearing loss for those who missed the first episode. And one thing that I've learned as I've gotten older and I've met other deaf, hard of hearing students and adults is not everybody loses their hearing due to genetics or like for me, mine was because I had an umbilical cord wrapped around my neck. So this was back in the 80s. Nowadays, they enforce that all babies are tested for their hearing as soon as they're born. But back in the 80s, I wasn't assessed until I was 6 months, and I've been wearing hearing aids since I was 15 months. There are a lot of options out here for people with this hearing loss. And so a lot of parents freak out. My kids can't hear. They're not going to be normal. They're not going to, it's not like that. The first thing a lot of doctors will try to say is get cochlear implants without realizing there are functioning deaf adults and families without cochlear implants. Some just wear hearing aids, like I do. I wear hearing aids. Some are just don't wear anything, and they learn sign language. And it's deaf family like me. I went on to two prestigious universities and graduated using sign language interpreter accommodations as well as note taking. By law, everything on TV has to have closed captions. This has been since 1993. So there are a lot more accommodations for deaf, hard of hearing, and so make sure you're aware of all the resources that are available for deaf and hard of hearing children. And I encourage families learn sign language, but as well as teach them, if you can, how to speech therapy and how to communicate, because that is important. Maybe they even learn how to read and write, to communicate when they go out in public. I can hear, so my hearing loss is different from someone else's. Also, I also want to add, not all deaf people know sign language. It depends when they lost their hearing. You can lose your hearing because you had a high fever or because you had a virus, or there are other ways you can lose your hearing later on. So just want to be aware that it's not just always everybody has to be oral or auditory, and then sign language. It's different ways of how people deal with their hearing loss. It's not one fix all. There are different services and accommodations out there for people.
Awesome. So when I'm thinking of, like, if I'm thinking about the takeaways here, one, as we've said, trust your gut. If something's up, something's up. Two, monitor the milestones, right? Those milestones of development. And if you're like me and have no idea what those milestones are, utilize, our good friend Google or your pediatrician. And if your pediatrician is not giving you a good answer, then it might be time to find a different pediatrician, because they need to be able to empower you and inform you as to what these milestones are. So let's say now our families we have a diagnosis, and since we have a diagnosis, we have certain rights, and those rights guarantee us to an IEP. And the CDC. So Chioma, the CDC has a Milestone Tracker app that is brilliant. Do you want to speak to that for a second?
Yeah, no, absolutely. Like I said, in like many states, not every because of funding, many states have a Center for Disease Control's Act Early ambassador, and there's just so many very cool free tools that anybody can download and access on the CDC's website. And one of them is this Milestone Tracker. So along with the milestones, I want to say, though, that we got to also keep in mind the 5 domains of development. Like there are 5 key domains of development that you kind of parallel with the milestones. So what should your child be doing at what age for communication? That's one domain, right? What should your child be doing at what age for physical development, as in their gross and fine motor skills, right? What should a child be doing in their domain of adaptive living skills? When should your child be able to button their clothes and zip up and eat independently, feeding independently, right? What should your child be able to do for cognitive awareness? When should your child read? When should your child be able to respond back to you with their own independent answer? So there's one thing to communicate, it's another thing to communicate with intelligence, right? Like to be able to have a conversation, and there's different intelligences. I mean, I'm just talking about your cognitive intelligence. And then at what age, what stage should your child be doing, having social emotional interactions? When is your child having too many tantrums, knowing that when your child ages 2, there's certain times when your child should maybe be able to self-regulate or not, or if they have social anxiety, or when you kind of flag some social emotional things. And those may be some of the harder things to discover in early childhood. But I mean, those are the areas of development, the 5 key domains, while we're also looking at what they should be doing by 12 months, 6 months, 26, 36, 48, whatever the number of months up to the age of 5, I think the tracker goes to. So, yeah.
And one thing I want to name, it can be very, I don't know what the word is, isolating, traumatic to start to notice that this person that you love more than life itself is not starting to meet these milestones. It can be devastating. And our natural reaction, at least at first, was to keep it close, keep it quiet, not really share. It's so isolating. But there's also a liberation to be found in acceptance. And there's a liberation to be found, not just in acceptance, but then in advocacy, right? Because once we know, like, all right, this is true, this is a thing, then you can start the work. And that's where the strength comes in. So let's say we have a diagnosis now, a family has a diagnosis, and they're getting ready for their first IEP meeting, either for early intervention or for preschool, or maybe even for the state schools. What are things they might need to know? And I'm going to start by talking to teachers for a second about IEPs, and then we'll pass it off to Joy and Chioma about what families need to do. So for teachers, I through my role as teacher, I've sat in on many IEP meetings. The first thing that you need to do as a teacher is read the IEP. Now, I understand that an IEP sometimes can be a huge document. It can be a huge document. And I am going to name that if I'm a teacher and I would teach 120 students on my caseload, and if a third of them have IEPs, which can be a truth, that's a lot of reading to do. If that is the case, there should be, if your school is really on it, what's called a SAG, a student at a glance. And what that provides for teachers is 2 pages of the big things you need to know: a diagnosis, goals, levels, accommodations, and maybe even some words from previous teachers, which may be good or bad, depending upon if we want to know that stuff. Teachers, we need to know these things, because I'm going to speak now as a dad of someone with special needs. If I come to this IEP meeting and it's obviously you have not read it, we have a problem. We have a problem because you, by not reading your student's IEP or a student at a glance, are now, in all likelihood, violating my child's civil rights, and now we have a problem. So the first thing for teachers to do out there is know your student's IEP. Know it. Okay. Needed to get that out there for my teacher friends out there, because we have work that needs to be done. So now let's think about a family who's about to get ready for their first IEP meeting. What is some of the mental things they need to get ready for, and what are the practical, tangible things that they need to get ready for? Joy, Chioma, what do we got to know?
I'll go. So first thing first, from years of being in IEP. So first thing first is parents. you are in charge. You schedule the IEP when it's convenient for you. I want to reiterate that because it's not when the teacher says, "Oh, I'm off." No, no, no. It's when you because an IEP can, depending on your child, depending on how what assessments have been done, an IEP can take 1 to a couple of hours depending on what's happening and maybe the milestones like Chioma talked about. Maybe some things need to be revised. I don't. It's just a lot that go into it. But just know this: you are definitely in charge. Don't let them tell you when the IP meeting is. You have to work together. Number two, it's good to know usually the teachers are supposed to send you quarterly an update or after I guess a progress report of the IEP. That goes with another progress report that the school provides. But you're supposed to get that quarterly so you can kind of see how your child is doing. So that way, when it is time for the big IEP, you're able to say, based off of this last progress report and from our IEP meeting, usually we have them once a year, from apparently my child's doing well on this or maybe needs more work on that. I would like to either continue that or maybe they don't need that type of service anymore. But they are supposed to give you updates on the goals that you guys have set at the last IEP meeting. Make sure all the parties are there. And this is the other thing I want to reiterate with an IEP is you're going to sign a document. You're going to sign an IEP at the beginning. And at least in California, that's how it is. It says who are the people who are present. So that would be parent, teacher, maybe principal, speech therapist, the whole IEP team. Usually there has to be some school administrator at an IEP. It can't just be a teacher. So that's important as well. And then at the end of the IEP, when you went through everything, you guys reviewed the whole goals and new goals, all of that stuff, then you sign it at the bottom saying, yes, you either agree with the IEP or you don't sign it saying, and that's another topic we'll get into. But just know that you are in power. And when you sign that, or whoever signs it, that is now a legal binding contract. And you can hold the school and the school district accountable because now you have this paper with everybody's signatures saying you agree to fulfill these goals.
Yeah, absolutely. I'm gonna comment on, and I don't know if we have the slides available. If not, I'll just talk it through. But I think like for any family that's like starting their journey, their key three elements the most important element for investigation is the child find process, and that is a mandate of the IDEA. And I think if we can pull up the slide, starting the slide that's up around the least restrictive environment. So the last time we talked about FAPE, free and appropriately ambitious public education. There's also there's child find, which is an important concept. And child find, I'll just sum it up to say that at any point before your child even gets an IEP or, becomes the discovery, like how do you get to the point where your kid is flagged? And every state has a timeline in which they determine how long it should take the state to evaluate, make the proper identification process, and ultimately offer the child an IEP should they be eligible. And I think I talked the last time that eligibility is a state's decision, right? Like the state sets the criteria for eligibility, right? So in DC, where I live and where I'm from, eligibility at this point shows that a child has to show a significant delay at a 25% level for a disability, for any one of the domains of development. Each state gets really technical about that definition of what is considered a delay, what is considered something to flag concern around your cognitive, your intelligence, around your speech communication. And you have to show it in at least 2 areas. I think that's pretty standard. For you to then be eligible for either Part C services, which is the IFSP, or Part B services, which is the IEP. And Part B again kicks in once your child is over the age of 3 years old, right? So if you identified before 3 years old, you would go through your IFSP process. And then if your child is above 3 years old, you would go through the IEP process. But both processes are beholding to these overarching themes of child find, as in from the point in which I say that I need help, the state has an obligation to meet their state standards as to when you have to make a determination of if the child is eligible for an IEP. In the District of Columbia, it is 60 days. Most states is 60 days. We actually had to pass local law because it used to be 120 days in DC, which is a long period of time to have to wait. That's almost 6 months you have to wait in order for your child to be identified. It shouldn't take that long to say, hey, I'm observing something going on with my child. And then it's the obligation of the state to determine eligibility. And you have to do that determination in the District of Columbia within 60 days. Check with your state education office. You call them up, email them, and ask them, what is the timeline? Because these become how you exercise your due process rights, which we're going to talk about. So I just want to talk overarchingly about big concepts. LRE is, again, it couples these. So these are complaint worthy, right? These are the things we complain about. These are the things that we file due process complaints about if they're not met. You can file a due process complaint around child find. Did they or did they not make the right eligibility determination in a timely manner? Did they go through those steps properly? Did they have, an analysis of existing data meeting? Did they have a multidisciplinary team meeting? Did they offer you prior written notices? If you're not getting all of these things, you can file a complaint at the state level or go through due process. And I think the next time we can go, maybe go to the next slide and just kind of talk very, very briefly. I know we're running out of time on the due process rights. So due process rights looks different for every state, as I mentioned. Some states have, can you go back to the last slide? Some states have a 1-tier system and other states have a 2-tier system. 1-tier means that you go straight to the state to exercise your due process complaint. So the minute you feel a violation around least restrictive environment, which says that your child was not properly placed in the least restrictive environment, that's by law what people should be doing. That's the standard, right? Like your child should be placed in a general education setting. The most restrictive environment is if your kid is getting suspended all the time or sent home, not showing up for school. No one's flagging it. No one's showing a proper accommodation. You're notifying the school. So sometimes schools can technically get you on it's your, like the parents' fault if you have like too many missed days of school. All of these kind of fit in with the LRE. But complaint worthy, if you go straight to the state that I want to exercise A, B, and C didn't go right around their identification, around their placement, around their education in terms of FAPE, and you can go straight to the state. The 2-tier system, and that's probably for larger states. I live in the District of Columbia. We're a city without a state, so we're 1 tier. But in a larger state, you have 2 tiers where you start the complaint at the LEA level, the school district level, and then if you don't come to a conclusive determination that all parties can be satisfied with, then you can go to the state level. Now, mind you, IDEA cases can go all the way to the Supreme Court, depending on the nature of the complaint and the number of times appeals happen, either from the plaintiff, which is usually the parent, or from the defendant, who's usually the state. So those are very basics, and I think the next time we can dig deeper.
So we only have a few minutes left, which just goes to, like, that's insane to me, because this goes so fast. So what I think we're going to end up doing next time is actually kind of picking up where we left off. So let's recap here for a second. how do we begin the advocacy for our children? Well, one, as we talked about, trust your gut. If something is up, something is up. And the first thing you need to go to, as Joy and Chioma said, is probably your pediatrician to check in on the milestones and the domains and domains of your child's development. When you are engaging in this process, keep records, write everything down, write all of these things down so you have records. When you have started figuring this out and you have a diagnosis and you start to investigate the IEP, as Joy has mentioned, prepare. Make sure that the time you decide is the time that works for you. Because as Joy said, you are in charge. You are in charge. What we're going to do and for teachers, read the IEP beforehand. What I think we should dive into next time is what happens when IEP meetings go off the rails. Let's talk. I think we'll talk next time about dispute resolution, best practices. We'll talk about this idea, which I think is so awesome, about how to disagree diplomatically. Right? I love that idea. So we're going to get into all of that next time. Our next episode will be on Monday, November 9th. Monday, November 9th. What we're going to do with that in that episode is kind of wrap up this discussion about how to start the process with engaging in IEPs that maybe go off the rails. And also we're going to talk about, because we didn't get a chance to today, we'll talk about how to kind of transition from world to world. How do we transition from preschool to elementary school, from elementary school to high school to college to life after? We're going to talk upon that. We're then also going to dive into how to take our advocacy from this level to the professional level. And that is the level that Joy and Chioma live in. That's not the level I live in. It's the level that they live in. So they're going to be leading that conversation, definitely. Thank you all so much. We are going to be sharing this video all over the place so we can get as much outreach as possible. Joy and Chioma, thank you so much for educating me on so much and just speaking with all of them. This is so much fun.
Thank you. This is great.
Thank
Talk
you.
to you guys next time.
Bye, everybody.